resistance and like lot of like up the layer markers. What about like sleep problems or stress management or mood swings? So they have like plenty of mood swing. One time they're saying this, second day they've totally reversed their answers. So what about the sleeps and the stress and mood swings?
I personally believe sleep is one of the main indicator for someone to get worse or someone to get better. Um, I don't think so. PCOS as such will cause sleep problems. Generally, having a bad lifestyle, which most of us have, probably you have and I have, most of us don't stick to our bed timings, and we keep confusing our brain all through the day and all through the night. So I think explain them that sleep is an important indicator for their recovery in terms of mental health and physical health also. Even sleep is related to their insulin resistance. Sleep is related to their blood sugar control. Because as a nutritionist, you know too, just diet is not enough. They'll also have to get good rest. So sleep won't go down because of PCOS, but just you not sleeping well can worsen PCOS. So I think we'll have to teach them some sleep hygiene techniques. Where
Okay.
do you want to know the sleep hygiene techniques? I can give you.
Yes.
Yeah, yeah. These are few simple things that that should help at least 50% of the people that come to you. Rest of them might need medications. First is maintain a bed timing. Even if you're sleeping late, it's okay. If you're sleeping at 12 o'clock, 11 o'clock, it is okay because no one can be ideal. So make sure they're sleeping at 12 every night. Don't be erratic with your sleep wake schedule. That is one thing. Second thing is, this is extremely difficult, I believe. Do not watch screen at least 1 or 2 hours before you go to bed. The blue light that comes out of the screen reduces your melatonin secretion in the brain, which will not help you maintain your sleep smooth. So tell them the importance of the blue light that comes out from the screen. On Amazon, a lot of people are buying these blue light blocking glasses. None of them will help. I mean, they might definitely help a little bit, but they will not help to another extent. The easier thing is to avoid screens. Put the charging port away from your bed. Charge your phone away and just put the alarm. Use the regular alarm, like the hand clock. You can use that instead. Me as a doctor, I can't keep my phone away because there'll be emergency calls. But if you think it's not an occupational hazard for you, just keep it away. Very important. Instead, read a book. Also, eating food. I don't know if you agree with me or not. You need at least 3 hours before you go to bed. You need to eat 3 hours before, so the nutrition reaches the brain. So it helps in sleeping well. However, if you're feeling hungry, you can have like a small snack before you go to bed. Even exercise is very important. PCOS and for sleep. Exercise should be done preferably in the morning, not before bedtime, because exercise releases endorphins, and endorphins are stimulating hormones. They keep you up and they keep you active. You don't want to be active. You want to actually wind down and go to sleep. So there are a few things, and one more thing is, you do not use bed for sleep, or unless it's for sleep or sex. Don't lounge on the bed. We all have this nasty habit. We just lie down on the bed, roll over, and we just keep looking at our phones. So basically, undo everything that you're doing. You'll be able to sleep better.
So I completely agree with the nutrients part. So we like a lot of people say that drinking milk before sleeping, so it really helps with the serotonin level. So I guess we can all agree upon. So the last question from my side is, so there is like in the age of 18, 19, and the women who have recently been diagnosed and started having facial hair or started having abdominal fat, so they have a lot of image issues and distorted body images. So how do you tackle them?
First of all, with or without PCOS, people have this unrealistic expectation of how a beautiful person should look like. They should look filtered like an Instagram post. So I think we should